4 hours and 45 minutes. People getting, like, for healing the wounds and healing the tissues after their surgeries, the treatments are much shorter. And it depends. Everyone's a little bit different. You have what we call a diving medical officer, and the diving medical officer, what he does is he tells the staff, the chamber operator, he tells the chamber tenders exactly what treatment they actually have to do. Some of them use what is called a table 9. Some of the treatments are only about an hour. And they go in sometimes daily. They'll go in every single day after their surgeries or to get treated in that. Number 5, HBO more rapidly heals vaso-deficient, poorly perfused tissue. The tissue that heals the slowest is that which has the least blood supply, such as the white tissues in the body. Tendons, ligaments, meniscus in the joints, spiral discs or spinal discs, bones, and even brain tissues are all capillary deficient, and each exhibit more rapid repair when benefited by the HBOT. We used to take pictures of patients that would actually come into the facility, the chamber facility. We would take a picture of them actually when they started their treatment, and we would take a picture, maybe after a month after treatments, maybe every 6 weeks or something like that. And you could see by comparing the pictures of the people that didn't have HBOT treatment that they started to heal much quicker, and their tissues the oxygen actually to help them recover much quicker. HBO regenerates damaged nervous system cells. HBOT neutralizes the toxic cellular byproducts and can return damaged neurons to prior activity. Okay, if this is so good, why isn't it utilized more? Why are more people doing it? Is kind of an example. When I got bent, I went straight to the hospital, and when I'd gone to the chamber, I had both my shoulders, and I was in pain, and I'm sitting holding my shoulders and stuff like that, and the nurse comes up and gives me a blanket thinking that I'm cold, and I'm like, no. I'm telling the lady, get me to a chamber. And then I asked her to bring me oxygen, and she brings me one of these nasal, and I told her I need some type of a demand regulator to where I could get more oxygen in there. And they're looking at me like I'm crazy. And it's just like, the doctors don't know. The doctors, a lot of time, I go into the doctors, and because I've been diving all these years, and I'm familiar with diving and the pressure and all of this. I'm talking to a doctor, and he'll sit there and tell me this, and I just, in my head, I'm telling him, you're crazy. The thing is these guys, that they're trained, they're surgeons, and they're specialized in their areas, but do they know anything about HBOT? And do they know the benefits of hyperbaric oxygen training or treatment? And they really don't. They just have no idea the benefits of doing it. You'll see, and I'll get into it in a little bit, that it's becoming more popular. A lot of the hospitals now are depending on how big the hospital is and stuff, they're getting like monoplace chambers in there. I've seen some hospitals say they've had up to 6 of them. And for a patient, they put them on a bed light, they slide them in there, and they can treat them for about an hour. And the bigger hospitals where they have more patients, they use the much bigger place chambers. Chambers come in, okay, I'll get to that in a little bit. But again, why isn't it used more? It's because people don't know. It's becoming much more, using the HBO2 is becoming much more popular and for treating patients around the world. It's not something that happens overnight, but it's by the education and by the training and that, it's becoming more and more, available. You got chambers here in Bangkok. They got, I did my DMT course, and they had one of the biggest chambers being built. I haven't seen it yet, but they have some of the smaller facilities where they had a bunch of hyperbaric chambers in there. Hyperbaric oxygen therapy, a primary or adjunctive therapy, both. It is, however, important to differentiate between HBO as a primary or adjunctive therapy. In modern medicine, HBOT is accepted as a primary therapy in only these conditions: decompression illness, gas embolism, acute anoxia, carbon monoxide poisoning. In other conditions, it does not replace all other forms of treatment, but it is valuable. But these treatments, what they've listed here, the decompression illness and the gas embolism, yes, it is a primary treatment for these. There are other cases where it's not a primary, but it's a secondary treatment. It does help to, it's like you'd give them medicine or something like that. Well, the oxygen is actually medicine. It's just like when the doctor, he's the diving medical officer, he'll come up and he'll give like a prescription. It's actually like, instead of giving them drugs, it's to tell them how long they got to be in the chamber on the oxygen. And that is what the chamber operator and tender do under the DMO's, under his care. This is just what a clinical policy bulletin, example of the current provider's level acceptance. Aetna considers systematic hyperbaric oxygen therapy, HBOT, medically necessary and will reimburse for any of the following conditions. So this is going to tell you, and it depends where you go around the world, and it depends on some of the insurance companies and stuff like that. Some HBOT is approved on some cases, but it's for healing certain illnesses, and in other places it's not actually, they will not cover it. Acute air or gas embolism, acute carbon monoxide poisoning, acute cerebral edema, acute peripheral arterial insufficiency, acute traumatic, peripheral, ischemia includes crush injuries. Like when you have a crush injury, if somebody's like in a car accident or something like that, and it crushes a limb or something like that, once they get them to the hospital, they treated them, they stabilize the condition and stuff like that, is they actually go put them in a hyperbaric chamber. The reason why they put them in a hyperbaric chamber is the high pressure of oxygen is to get the most oxygen they can into those tissues, into the damaged area. So this is where the HBOT really comes in a big help. I'm not going to go through each one. Compromised skin grafts and flaps in it. Someone has some different skin grafts in that, but again, the oxygen helps to heal the wounds. Okay, I'm not going to go through each and every one of it. That's a little bit above and beyond. Over 150 off-label conditions are treated worldwide. Actually, autism. Last time I was down in Sami-san, I was talking to the diving medical officers there. Actually, they were doing studies on children with autism. I have my friend, he's a diving medical officer in the Philippines. They're doing the same thing by treating them with oxygen, helping getting oxygen in the brain. When you have, it helps to, when they have problems with their thinking and that the oxygen helps to heal that up. Cerebral palsy, stroke and traumatic brain injury, post-surgery wounds, again, you have some type of major wounds, and again, they're actually doing. I was in Bangkok Pattaya Hospital one time, and I was in there, I was sitting through a treatment, and this was the first time I seen this done. It kind of shocked me. It was just like, it was a lady, she was actually unconscious, and not in the greatest of shape. Actually, they put her in the chamber. When you pressurize the chamber in it, you actually have a hard time equaling. They actually perforated her eardrums so they could actually pressurize her. And because she was in a car accident, she had parts that were crushed. She needed the oxygen, so they actually punctured the eardrum so they could actually treat her in the chamber. That sounds kind of terrible, but I've actually punctured my eardrums before, and it doesn't take long, a couple, 3 weeks, it was healed right back up. But just to show, to tell you, to let you know how important that the HBOT actually is. Okay, here we go. Types of hyperbaric chambers. What type of chamber do you use in Singapore? Huh? You have a lot of them?
Yeah.
Oh, do you? Okay. There's many types of hyperbaric chambers that are being used. We have monoplaces for single patient treatments. We have you'll see these in the hospitals where they're on a bed. I'll show you a picture here in a minute. They slide them in there. They sit there and watch TV. They don't have a mask on or anything. What it is it's acrylic tube, and they fill the chamber up with oxygen. The patient sits or breathes and watches TV. It's very easy. It's very comfortable for the patient. So it's actually a monoplace. It doesn't take up a great deal of space. You have multi-place for multiple patients. One of the chambers that we're using in the Philippines is a 14-person chamber, and it actually has 2 different rooms. So it's actually, if you're treating some patients here, and one of the patients need to have be looked after by a doctor or something like that, maybe it's something that the candidate can't take care of, but actually the DMO, the diabetic medical officer, can come into another compartment. Then they pressurize the chamber and equalize the pressure, and then they'll put them into the one patient or into the one room where they could actually take care of the patient that's having problems. We have inflatable, soft or lightweight, and portability. These are kind of in remote areas. They actually fold them up, and they can collapse, and they can put them in a in a box, probably about that big. About like that, and you could actually, some of them they put them on liveaboards when people are on these liveaboard trips going a long ways away, and they're a long ways away from the chamber. But actually, they can pull out this. They have problems. They can pull out the chamber. They can set it up, which doesn't take very long to set it up. They can pressurize the chamber. They can actually, they're not going to fully treat them, but they can pressurize them and stabilize them, at least good enough to get them to a full size a chamber where they have the diabetic medical officer in that. Some of the chambers are made out of steel. Some of them are like a acrylic tube, and some chambers, depending on the size, it depends on how much money they're willing to spend too. Being a single or a double lock chamber. This is a monoplace example, and it's just an acrylic chamber, and the door opens down here, and a bed, you can see it right there, yeah. The bed slides out, they lay the patient in there, they slide them in, and then they close the door, and they could sit there and they could actually watch TV and everything. They don't have a mask on. The only time they wear a mask is if they're doing an air break, but usually they pressurize the chamber, and the patient just lays there, and the treatments usually in those are only about an hour or so. So those are mostly used for just like healing wounds, and that's actually, it looks like I think it's a sea Christ. And here's some more examples of some different name brands of monoplace chambers. And okay, this is a Pressure Tech, a Flexi-Lite HB chamber. And again, this is a portable one. You could actually, just the material, it actually folds down and it collapses. and it's again, it's portable. It's another term for it. It's just a portable hyperbaric chamber where they can store it in a place where, if they don't have room for a big double lock chamber, something like that, they have something like this where they could, like you have a liveaboard trip and you're going out for days and stuff like that. These are very nice, where they don't take up a lot of room, and they're very easy to operate in that, but they have the safety there for the divers. Okay, here we go. Multi-place examples. These are the ones basically I've worked on, been using the most. This one here, you can actually walk right inside. Some of them, the older ones, you can actually, they have like a round door, and it's a little bit more difficult to get in, but now they have them now where the patient, you walk right in. You walk right in. They got chairs inside. The one we have in the Philippines, it has a TV inside. It actually has a temperature control, because when you pressurize the chamber, sometimes when you pressurize them, they're going to heat up, and when you're ascending, you let out the gas, it's going to start getting cold. So it actually has a temperature control in there, and it's all done electronically. You just set find out what the treatment is, and you put it in the computer, and it just runs. It does all the pressurization and everything. You just have people there that overlook it in case of, to keep an eye on things. But here we got patients. You can see that they got masks on there, and sometimes they have hoods, just hoods that go down over their heads, and they just sit there, breathe. They're nice and comfortable. They have other type of masks where they covers their mouth and their nose, and it has the regulator. It's a little bit more old style, but again, they work good, where the person just actually sits there and breathes oxygen. And the bigger chambers, like I was saying about the monoplace chambers, is they would fill it up with oxygen. These here, they wear the mask the whole time, and they'll breathe the oxygen. And the oxygen is vented out, because if you start filling up a big place like that amount of oxygen, you have problems with, because they're flammable and stuff like that. So actually when they breathe the oxygen come in and it vents it right back out. And sometimes around your masks, when you're wearing the mask and stuff, they'll start to leak oxygen in there. They actually have oxygen sensors, and it tells you if the oxygen starts to creep up in there, they'll actually vent it, and they'll let air out and replace the air. They try to keep it around 21%. That way you don't have, you don't get a lot of oxygen in there. There's some more examples of some multi-place chambers, smaller ones. Looks like it'd be 2 and 4 place chambers. Unequal performance under pressure. Anybody got any questions? They do have, we do run normal scheduled courses for people wanting to learn how to run, to become a hyperbaric chamber operator, to become a tender. Again, a chamber operator is someone that actually is outside and learns how to work the controls, to pressurize the chamber, and to do things like that. You have tenders. The tenders are the ones that actually, like you have nurses and that, and the tenders actually, they prepare the patient for the hyperbaric chamber, and they actually take them into it. The tenders will sit through the complete treatments with the patient. That way, if there's anything wrong, with the patient, if he's feeling uncomfortable, he has a tender there to sit there and talk them through it, and to let them, to try to get them comfort. As you can see, some of the chambers some are a little bit smaller than others. If you get a little claustrophobic, I do too. Yeah, a couple times I'm like, dang. But you got somebody there, a tender, to actually take care of you and to look after you. At the chambers, we have DMTs also, and the diver medic technicians. They're there. They're highly educated, like an EMT in the hospitals. And that the DMTs actually will be the first ones on the site. and they were actually able to take care of the patient until they get them to the chamber facility where they're checked in by the nurses, looked over by the doctors, and then taken care of by the chambers and the chamber operators and tenders. Well, if I don't have any questions, or if you have questions, feel free to ask. Thank you for attending, and enjoy the show.
Hello. Thank you very much, Mr. Bird. Thank you for